You're welcome.
I want to turn now to CBS News Chief Medical Correspondent Dr. Jon LaPook. Dr. LaPook, I'm just curious, what does it mean for someone like John McCain to announce, I'm stopping my treatment?
Well, he's saying that we're going to now turn to comfort care, which means we're not going to do anything specifically to treat the cancer, and instead we're going to give him things that make the quality of his life better. So that would be, for example, steroids to decrease the swelling in the brain, anti-nausea medication, pain medication, and any kind of things that would just make his day-to-day living more comfortable.
Remind us again, what kind of cancer is he facing, and why is this, it seems like it's so tough to treat?
Right, a glioblastoma is a primary brain cancer, which primary means it started there, and that's as opposed to one that spread there from someplace else. Like we know that President Carter had a melanoma that spread to the brain, and that was more easily treated with something that boosted his immune system. But this is a primary brain cancer, and it's extremely difficult to treat. And the reason is that by the time the person gets a diagnosis, it's already spread, even invisibly, along nerves to different parts of the brain. So you may see on a CAT scan or an MRI this mass, and you take it out to do what's called debulking it. You take it out with surgery, and maybe you treat it with radiation therapy, and maybe then you give some chemotherapy on top of that. But what are you doing about the fact that the cancer is already spread elsewhere? And that's why the prognosis is relatively poor, and it's such a brutal cancer to treat.
Diagnosed in July 2017, so last summer, it's been about a year. He's undergone all sorts of treatments. Why is this, though, different from Jimmy Carter? Because when it came out with Jimmy Carter, we thought, oh gosh, this is the death sentence. And we've heard from him recently in the Washington Post. He seems to be living a good life. What's the difference here?
Melanoma, which was the primary tumor that President Carter had, for some reason, it seems to be very amenable to things that boost the immune system. And in fact, Dr. Steven Rosenberg from the National Institutes of Health has a patient who's survived for decades on immunotherapy of a melanoma. So the treatment was able to somehow cross the blood-brain barrier. So one of the obstacles is that the brain is sitting in this protected area where chemotherapy can't get across to it. But by boosting the immune system, somehow it's able to get across into the brain, across the blood-brain barrier, and actually go in, hone in on the cancer, and kill it. And in the case of President Carter, so far, he's done really, really well.
Is there anything that can you detect if your father has this type of cancer? Are you more likely to have it? Is there anything you can do to prevent it?
Yeah, you know, there are genetic forms of it. For the most part, I think people really, there's no preventative thing that you can do. For example, they're not recommending that people go ahead and get routine scans of the brain or anything like that. People are looking at epidemiologic factors, meaning what are the things that you can do in your life to decrease the odds. I know there's been a lot of talk about cell phones. That's really never panned out as something that's a definitive cause. There have been some people on either side of that. But I think for the most part, it's something that really where we have to focus all of our energy is on figuring out ways of treating it once it is diagnosed. And of course, it's diagnosed when people have symptoms because the brain is such a small area. There's no place for the brain to swell to. So when you get a mass in an area, there's a little bit of swelling, it starts pressing on nerves. Depending upon where the nerves are, you can start having symptoms. In the case of Senator McCain, remember that he had it over his, I think it was over his left eye, and earlier than when the diagnosis happened, he had some trouble with speech, with a little bit
I remember hearing particularly
some halting, and so that can be a clue. But we need, and the research is going on about all sorts of medicines to try to go after this. We know that 60 Minutes did a piece about Henry Friedman and the folks down at Duke about using the polio virus. You would never think the polio virus, but it somehow it attaches itself to nerve cells in the brain, and it's not that it necessarily wipes it out itself, but it sets off an immune system. It wakens up the immune system and says, hey, I'm here. And then the immune system comes in secondarily. There have been some mixed results with that too. So we still don't have a great treatment for it. People are going, I know, left, right, and center after a treatment, and hopefully someday a cure for it.
I certainly hope so. Dr. Jon LaPook.